Welcome to today's episode of More Than Milestones. I have here with me today Bri Miluk, who is a speech-language pathologist specializing in infant and medically complex feeding and the face behind Pediatric Feeding SLP on Instagram, where she shares a ton of education and a ton of debunking misinformation on social media. I'm so glad you're here with us.
I'm so excited to be here. I was
Oh my
really
gosh.
excited to first hear that you were starting a podcast, but then secondly, be asked to be on the podcast. So thank you so
Yes.
much.
Oh my gosh, yes. And we are going to be tackling a big misinformation topic on social media today. We're going to be talking about primitive reflexes. But before we get started, Bri, you want to just tell us a little bit about yourself?
Yeah, absolutely. So, like Casey said, I'm Bri, and I'm a speech language pathologist by trade, and I primarily work with and specialize in infant and medically complex feeding. Most of the patients that I see tend to be like younger, so usually under 3, but I see kids all the way through the ages. I am also working on my PhD through the University of Alabama right now, where my research focus is on misinformation on social media in pediatric feeding. So
Oh
this is like
my
my
God.
jam. I was really excited to talk about this.
Oh man.
But yeah, I think, outside of that, I always say like, okay, if I'm not working or studying, then I'm a new mom. So I'm spending some time with my little one, or I play kickball. I like to read.
Love
So
it.
yeah,
Love
that's
it.
kind of
Oh my
it.
God. I cannot get over the doctor. That is so stinking cool. Your PhD, that's amazing. And that makes me even more excited to get into all of this. All right, so let's kick it off. First, I know that this topic is kind of complex, and so we're going to try and take you through parts to make it understandable, easy to digest, really starting with just what are primitive reflexes? Are they even real? Um, Primitive reflexes are absolutely a real thing. They are pre-programmed motor pathways that allow a child to move and react to their environment. So basically, they are innately present involuntary movement patterns and automatic responses to environment stimuli that aid in development. And the purpose of them, just as a super quick overview, is to allow a child to move and react to their environment, facilitate survival, movement, sensory motor development, and the integration of them ultimately allows voluntary movement and lays the foundation for the emergence of more complex movement patterns like crawling and walking. So we're going to take you through some of the common ones that you probably noticed or noticed your baby doing, even if you didn't realize they were actually primitive reflexes, which is super cool. But the when and the how behind the integration of them. So in general, most of the primitive reflexes are expected to integrate within the first year of life as the brain and nervous system mature and baby begins to respond to stimuli within their environment, moving with more intention, more voluntary control. And generally speaking, the integration of primitive reflexes falls into 2 categories. So there's earlier integrating and then later integrating reflexes. So for example, 2 of the common ones that we'll touch on a little bit more are the Moro or the Stardo reflex and the palmar grasp reflex, which both integrate earlier, so like in the first 3 to 6 months of life. And you might recognize the Moro reflex when you think of like the reason that a lot of people swaddle, right? So when you go to lay baby down, their arms go out, they wake up, they start to cry, their arms come back in quickly. That is actually a primitive reflex happening right in front of your eyes. But then it goes away and obviously will be much less disruptive to sleep. And then similarly, a lot of us probably remember that moment where like you put your finger in your baby's hand and they grasp you for the first time and you're like, oh my God, that is actually the palmar grasp reflex, which is super cool. And it's a super special memory, but it does integrate within the first few months of life, when then baby is going to start to intentionally reach for toys, grasp and release, really start to develop the fine motor control in their hands. Okay, and then in comparison to those, there are ones that integrate a little bit later, so between like 6 to 12 months of age, some even up to 24 months. So things like the symmetrical tonic neck reflex and the asymmetrical tonic neck reflex, and those really integrate as a child moves through their environment and pave the way for higher skill development, balance, coordinated movement, all of those sorts of things. So some other common ones that parents likely would have noticed with their babies. Bri, I'm going to turn it to you to talk a little bit about like the rooting and sucking and
Yeah,
how those build
definitely. I
in.
feel like the rooting and sucking reflexes too are really good ones to emphasize that a lot of these primitive reflexes that are present at birth are to help with survival. They're a safety
Yes.
mechanism that's put in place to help the infant until they gather more information about their environment from a sensory motor component. So the rooting reflex is if you are going to, like, if you touch on your baby's cheek, for example, especially if it's getting close to feeding time, they'll typically open their mouth. They'll start to open their mouth really wide. And that's really helping with them finding their feeding source. This typically integrates around 4 months, which is very similar to about when the sucking reflex will integrate. And the sucking reflex integrates when, or the sucking reflex, excuse me, is when you place an object, a finger, a bottle nipple, a nipple in the infant's mouth that they will begin to suck. And so it's really this involuntary response to say like, okay, you suck to try to get your food, to try for survival, right? And over time, as the baby feeds, as the baby gains more control over that through those exposures, through that sensory motor experience, those will integrate. And then it becomes where they have more control over it. So this is why sometimes I find families will say like, they were feeding super well, but around like 2, 3, 4 months, I notice like they're pushing it away more, or they're not sucking on their bottle right away. And that might just be that they just have more control over it. So they're really going to have a better chance to say whether they want to feed or not at that time.
Love it. And how about I'll go into this one. Okay, so this is one that I get asked about all the time because people will be like, my baby just wants to stand, but it's actually reflexive in nature at first. So that is the stepping reflex. So that's basically where baby is going to take weight through their legs. And then depending on what the pressure on the sole of their foot is, they will even make like a walking movement, which is pretty cool, but it is reflexive. So that integrates around 2 months and it really makes the way for more purposeful weight bearing, which we're expecting from baby by 6 months. And then the Landau is another one that's a little culprit. A lot of people are like, what happened to my baby? Or your baby was rolling and all of a sudden now they're on their belly and they're flipping out and swimming all over the place. So the Landau reflex is when baby is down, they're going to start to extend their head and back and legs, and they're almost going to be like swimming. So that starts a little bit later, around 3 to 6 months, and integrates by 12 to 24. And the whole purpose of that is really to strengthen the neck and back muscles and prep the body to be ready for things like being able to sit, crawl, all of those higher level skills. So again, really working to lay that foundation for more voluntary, complex movement to happen. So let's talk a little bit about how primitive reflexes actually integrate, like what influences that timeline, because I think with a lot of the claims floating around, both the science and the pseudoscience worlds, about everything from like the method of delivery, vaginal versus C-section, like we see a lot of claims, especially on social media, I feel like, a lot of blame on like maternal choices and things that were outside of mom's control. And then really talking through like the quality and quantity of floor time. And it can be so hard. And we're going to talk more about this later. It can be so hard to sift through what's true and what's not and what falls somewhere in the middle. So in general, primitive reflexes are integrating via 3 main factors: sensory input, motor development, and then brain and neurological system maturation. So basically, as baby is receiving and reacting to stimuli within their environment, they're going to start to move through their environment during things like tummy time, back play, and again, that brain and nervous system maturation. But let's talk about when they're retained. So I just want to make this one statement. I have always felt like, especially, so like in PT school, we really don't talk about the primitive, we don't learn. I mean, we have one pediatric course. So like anything you learn, you're going to learn after the fact. So primitive reflexes were not really part of our schooling at all. That is definitely, at least in our program, that is much more of an occupational therapy thing. So for me, going into working in a facility where a lot of children had diagnoses that involved their neurological system, I always felt like where was the line between a reflex truly being retained versus that becoming a learned movement pattern that gets them what they want, right? So like, for example, I had a child who some people might have said they had certain reflexes retained. However, he also had really strong extensor tone. He also had all of these other things. And so he would use certain movement patterns like the ATNR to get something that he wanted. And it was a voluntary volitional movement that he knew could get him something in a way that he couldn't do in any other way. So at that point for me is where I really started to question, like, yes, they can be retained 100%. I am not saying they're not, but I've always I would just love to hear your thoughts. And I know I'm throwing this at you. This wasn't planned at all, but I would love to hear your thoughts on that because like that always made sense in my brain from like an anatomical and a cognitive standpoint. Like if you have learned that works for you, you're going to keep doing it and you're going to keep reinforcing it. And it's at what point is it no longer a reflex or a retained reflex and becoming like a voluntary movement?
For sure. So I think one thing to start with is just in case anybody listening isn't quite sure what retained exactly means, this means that like past the point of when we expect that reflex to be gone, a child is still showing it. So this would be like if they have that that startle reflex, which is where an infant really, it's more than a startle. I do want to say that like some of these are a little bit more than, because, right now, if somebody was to pop in this room and be like, hey, I would startle, jump, right? I would have that jolt. That does not mean that I have the moral reflex that has been retained, that I still have
Which
it.
I think is a very important point when we talk about the testing that is being done.
When we go to testing, we'll go through that a little bit more. But I just want to say that like retain truly means that this reflex is there. And that goes into a little bit of the question that you said, we didn't plan for this one, but I'll answer it. Is I think when it becomes something that they have voluntary control over, we really would say that actually the reflex probably is not retained. They probably have integrated and they have more voluntary control. However, they realized that that movement was helpful. And so what happens is this movement is helpful for me to XYZ, whatever the functional thing that child is trying to do. And because that is helpful to them, they start to use it for something. So now they're getting that sensory motor feedback every time they use that movement. And that's really what helps these reflexes to integrate, is that they start to do something repeatedly. So the body no longer has to rely on it being reflexive, but it learns that motor pattern. It learns the sensory input. And so it can do it in a voluntary manner. So it doesn't mean they don't ever use these movements again, right? Like sucking. It doesn't mean an infant integrates the sucking reflex and they don't suck. It means they've gained more control over it. And I think that's really where it comes into play of like whether it's retained or not. Because if a reflex has not been retained, then when you are seeing it, it is completely involuntary. Regardless of whether the infant, the child wants to do it or not, they don't really have control over it. And we'll talk a little bit more about that in assessment. But I think that's kind of the biggest thing we want to look at is like, this would be something that every single time, like with an infant, every single time you touch on that cheek, that mouth is going to open every time. Now, as it starts to integrate, it might happen sometimes and not all the time. And then once it's integrated, it's probably only going to happen if they're trying to bite you or they're going for it. And so that's where we also have to be careful to recognize like the frequency of it. And when we're assessing it, knowing also just normal variations of voluntary movement as well.
Love it. Love it. That makes it very clear for sure. It is possible for them to be retained or to have never shown up based on factors like, for example, extreme prematurity, because a lot of those reflexes start to develop at certain points in utero, right? So let's say we're expecting it to start emerging at 28 weeks gestation, but you were born at 23 weeks gestation. You have not had that opportunity for that to happen. So there are times where things are retained or have never shown up. And that can be associated with a lot of different developmental difficulties that impact many of the domains of development, like gross, fine motor, social, emotional, cognitive, communication development, sensory processing, posture, balance, body awareness, all of that stuff. But they're not the primary cause of those things. So what we're going to kind of go into now is what happens when they don't integrate or they've never emerged, what can be done, if anything, and what do parents really need to know about misinformation and pseudoscience and fear-mongering tactics that are so commonly seen in the kind of retained primitive reflex space, especially in terms of treatment and interventions. So I'm gonna hand this over to you because I feel like this is where you really shine for me. Can you talk to us a little bit about correlation not equaling causation?
Yes, absolutely. So I think first, let me reiterate what you said. Retained primitive reflexes, having that present is absolutely possible. It is a thing, but they are oftentimes the symptom of something else, not the cause. Okay. So that's the whole like correlation does not equal causation. So claiming that claiming retained primitive reflexes are the cause of things like behavioral issues, DHD, behavior. I feel like I've seen like so many things, sweating, trouble with reading, trouble with walking, trouble with, right? Whole big list of stuff. Some of the things are just, I don't even know. Yeah. They're way
flat.
out. Right?
Out pulled out of someone's booty.
Exactly.
Yeah.
Okay, you just threw that one in there. Those things, all of those pieces, yes, we may see a correlation, right? We may see that a child with retained primitive reflexes is more likely to have difficulty with reading, attention, behavioral difficulties, motor learning, gross motor, like all of those things. However, with primitive reflexes, they are neurologically based. And if we see that they are retained, and I'm going to throw in also or absent, they never ever showed up to begin with, then typically we want to be thinking about an underlying neurological diagnosis. And when we think about children that have neurodevelopmental diagnoses, we can see those other aspects come into play. And so I think what the biggest thing with retained primitive reflexes is remembering that, like, that is a thing that is absolutely something that a child can have, but it's not the cause of other concerns that someone may have. It's a clue into maybe why those other things are going on that could point to, like, wait, maybe there is something else neurological going on here, but it's not the cause. I'm going to give like a really quick, like, some of you have probably even heard this, but like correlation doesn't equal causation. So it's like saying that eating more ice cream increases your risk of sunburn. Okay, so we see that as ice cream sales go up, so does sunburns. Okay, but if we just compare those two, we could be like, oh my gosh, it must mean that if you eat more ice cream, you're going to get sunburn. No, they are correlated, but they're correlated because guess what? People in the summer tend to go outside more and want ice cream more because it's hot. So yes, those things are associated. Wow. But that doesn't mean they're causal. It's not one or the other. You'll see the same thing where people are like, it must mean that like eating ice cream causes shark attacks. And it's like, no, we just tend to eat more ice cream when we're at the beach, and you're more likely that there's going to be sharks around when you're in the ocean, right? So correlation is one factor to look at, but it's not the only factor. And so that's where when we see retained primitive reflexes, yes, we will see, and we'll see that in research. And that's where I think some professionals are like, here's a study that showed that they were correlated, but we have to get into the actual nitty gritty of like, well, what was the quality of that study? Did they control for anything else to say what else might be the cause? What were the other diagnoses? And paying attention to that, because if the reflexes are truly retained, then we have to consider that actually as something possibly neurological going on. And I don't say that to scare parents. I don't say that to scare you all about that, especially if you've heard it about your child before, which is why I know we're going to talk about assessment here in a second, which is why it's also really important to be aware of how these are assessed, and how we're pathologizing things. So creating potentially a problem versus something that may not actually be there.
Totally. And I think that another really important piece of what you said is that a lot of times that means a child should be seeing a neurologist first and foremost before they're starting therapies, before they're starting interventions. If there are truly retained primitive reflexes, we need to be better about referring to the appropriate person to be sure that we have the full picture and not just the picture that we think we want to create to sell a service or whatever it might be. So let's go right into it. What are your thoughts on assessments that are commonly used to test whether a reflex is retained or not?
Yes. Okay, so these assessments, I'm sure you all have seen these videos of some provider holding a child and pretending to drop them. They say, oh, look, they startled. Their moral reflex is still there, still present. If you did that to me, guess what would happen? I would startle. If someone all of a sudden was like acting like they were holding me safely and then pretended to drop me, you know what would happen? We'd all startle, right? But there is a difference in what those reflexes look like. And unfortunately, the assessment tools that are being used, the assessments that are used, are super, super subjective. So because they're subjective, that means there's a lot of room for bias, there's a lot of room for error, and there's a lot of room for, I think with the bias side to kind of emphasize, there's a lot of room for the cognitive bias or of, what's the word I'm looking for? Well, for confirmation bias. So meaning the provider wants to look at reflexes. They really believe in retained primitive reflexes causing XYZ, so they're probably going to see a retained primitive reflex. And that's why it's so important to look at the psychometric properties of assessment tools that we're using. And we can't always have ones that are really reliable. Psychometric properties, are like the reliability and the validity of the test. So I always use like a very cheeky example of this would be like, if you can't touch your toes, then you don't like onions. And it's like, okay, like, well, are you sure? Yes, because anyone I know who can't touch their toes doesn't like onions. My N is me. I can't touch my toes and I don't like onions. Okay. That doesn't make sense. That doesn't make any sense. And so we have to think about like the plausibility of an assessment to actually say what it's doing, right? What it says it's going to do. So if we have an assessment that's super subjective, that means from person to person, somebody could be using this assessment and they get a completely different outcome than this other person because of that bias. Because of that bias, some people can overdiagnose and some people might underdiagnose or misdiagnose. And I think that's also something that that's really a risk of using these assessments is like a child can miss getting the support that they actually need as soon as they need it if we're incorrectly testing them or incorrectly diagnosing, especially when we're using things that are super subjective like this. And like Casey said a minute ago, if someone tells you, regardless of their assessment, if they are telling you your child has retained primitive reflexes, they should be sending you to neurology because that signals that something neurological is going on. It shouldn't be happening that way. It should be that naturally, as a child develops through their environment, motor and sensory experiences, those things should integrate. And if they are not, that is telling us something else is going on. And I think that actually is a good point to go back to talking about like how they integrate. So we can have, for example, retained primitive reflexes, we said, through experiences in the environment, sensory and motor experiences, as a child explores their environment, starts to wiggle, starts to move, those integrate. If you have a child who's having difficulty with moving, with meeting those gross motor milestones, then it's not the reflex are causing, the retained reflexes are causing that to happen. No. It's I'm having difficulty moving in my environment, so I can't retain my reflexes. And that's another example of like that correlation and causation, right? They are correlated because the child isn't able to experience their environment the same way. That's where we see that a lot in feeding in preterm infants who maybe haven't had any sucking experiences. They haven't had the opportunity to try to feed. And sometimes that sucking reflex is never present to begin with. But then also they may have trouble integrating it because of a lack of experience. So that's kind of a side note, sorry, but I felt like that was important to put in there because it goes into assessment. Assessments are meant to tell us if something is present or not. It doesn't necessarily tell you the why.
Right.
And so when doing these assessments, one, we have to understand the difference between primitive reflexes and then also reflexes as adults and what that integrates as, because integration does not mean it goes away entirely. So again, moral reflex versus startle reflex. This is why it's important. The moral reflex is in infants, it's arms splayed out and they come in and their palms are up. Now we might startle, but it doesn't look exactly the same. And so we have to pay attention to like the difference there. And I think you probably have a couple other examples of these, right?
I know the spinal galant one is too. And as someone who is extremely ticklish and also has scoliosis, I could tell you I will test positive for the spinal galant being a retained reflex every single time, but I'm A-okay. I think another thing that you said earlier, I wanted to mention this. I think what's hard about it as well for parents, and we're going to give you some tips at the end to kind of navigate this a little easier, but I think what's hard for parents is that if you have already reached the point where you feel like this is going to be it for your kid, or you're having trouble finding something that's like making it all click, and you're seeing these videos, these testimonials that are very, very much emotion and fear-based and all of that. I think it's also when they're doing the testing and you're trusting them, right? You've already paid, you're already here. You wanted to see what this provider has to say, right? They do something and they're like, look at that. Of course, any parent is going to be like, oh my God, okay, this is it. Yes, this is it. Let's do it. That is all such a big piece of this too, that I think is what gets to me the most is the tactics. But let's go back. Okay, so back to like primitive reflexes versus adult reflexes. Yes, it's like, I think really understanding that the primitive ones are present at birth or shortly after. They are controlled, involuntary controls via the brainstem, serving the purpose of survival and development, right? Like we know when they're going to integrate. If they're present in adults or they're retained, it is indicating something neurological is going on, right? Versus adult reflexes are developing as primitive reflexes are integrating and development is progressing, right? So those are controlled more by the cortex and advanced higher brain centers. Those are serving the purpose of things like posture, coordination, balance, things like writing reflex. So like if someone pushes you, you don't fall every single time. You might step backwards. That is a reflex, but that is not not associated with anything related to a retained primitive reflex, right? It's not a concern. We want to see those things. So once those are present, they're going to be there throughout life, aside from obviously like age-related changes and things like that. But the importance of those ones are that they're essential for successfully moving against gravity. So really understanding the difference between those two things, I think would hopefully be helpful in parents that are considering this as a next step, to just know whether they're walking into it with a clear, unbiased head
Yeah.
to watch the testing, you know?
Absolutely. And I think too, like a lot of times in these assessments, you know, you are going in to an assessment because of concerns you've had with your child, right? Like you already have these concerns. So like Casey said, you're probably like, okay, I am going in here because this person claims that they're going to be able to help with XYZ. And we go in there. And unfortunately, what we see with some people that, you know, make these big, broad claims about stuff, like if they're creating the problem, and don't worry, they have the solution, right? Like these are things we have to be really careful about. And again, we're not saying retained primitive reflexes aren't a thing, but we just want you to be cautious about the information that's being shared about it, about the way that they're sharing it, about how they're justifying things behind it. Because like we said, like we all have adult reflex. Adult reflexes are a thing to, again, continue to help with our survival, but they're not the same thing as primitive reflexes. And they don't they're primitive reflexes that are retained are not causal of some of these other pieces. And I think we also have to be careful when, especially at a time of social media, that we are not diagnosing things as abnormal when they are normal variations of children.
Let's talk a little bit about that. I feel like that's a perfect segue. I'm sorry to cut you off, but this is
Yo,
like,
you're good.
let's do it. So hey friends, Casey here. If you've ever listened to an episode and thought, I wish she'd go even deeper, or I wonder what she really thinks about that, I am so excited to share More Than Milestones Unfiltered, where I do exactly that. More Than Milestones Unfiltered is my private Substack community where I share 2 exclusive podcast episodes every single month. 2 episodes that will never make it to Instagram or the public feed. These are the even more raw, unfiltered stories, harder conversations, and the that's a story for another day moments I usually hold back on. If you want to join me there, just head to the show notes or my link in bio and subscribe. I'd love to see you inside. Over pathologizing normal development. Let's talk about it. I mean, we're going to have a whole other episode about reflux and tethered oral tissue at some point. but let's talk about it. Give it to me. Give it to me.
Yeah. So I think the biggest thing here is, and this is with misinformation and pseudoscience online, this is like one of the biggest things that we see, is that somebody is taking something that is real, a real diagnosis, a real concern, a real problem, and they are making it into something that becomes relatable to like absolutely every child under the sun. Okay. So for example, when we think about primitive reflexes and attention, okay, I can't tell you, I don't think there's ever been a parent that's like, I have trouble getting my 3-year-old to pay attention, or, you know, they're having trouble with listening, or XYZ, right? And some of that is normal childhood development. The child is going to have very short attention span. They're going to want to pop from task to task. They're going to have potentially listening because maybe we're talking to them at a higher level now and expecting, you know, them to understand bigger sentences, which is great, but it might make it seem like they're not listening, or they also have a lot going on with the emotional development at that time. So we see big emotions and we see lots of changes that are happening in there. And it's so easy for somebody to say, your child having all of these different types of things going on, which are normal parts of development, but they call it a problem and say, it's probably this. And I think for parents, it's really hard for us to think like, because your child maybe is having difficulty with this type of behavior or paying attention. I say attention and stuff because I feel like that's a big one that's used with primitive reflexes, is that, you know, well, it couldn't possibly be my fault that something's going on. And so something must be wrong that we need to then fix through this. And what happens is it probably wasn't anything that you did wrong. it's actually probably your child acting developmentally normal, how they're supposed to be. But what happens is this person comes in and says, oh, well, I have a solution. Let me give you this, I see like curriculums for like reflex integration, like as if it's just this thing that you can like, put over top of any child and it's going to fix them. That's also a red flag, everyone. It should be individualized support to your child. The plan should not be a handout or a worksheet or a workbook that you work through. That's another note. I'm literally like losing my train of thought because I got
I get it.
that for a moment.
We're going to go back to that. We're going to circle back to the importance of that.
But all that to say, like, they tend to use things that are very typical of children, try to make it seem like this is a problem, offer you a solution. And typically what would have happened is that with your child developing, those things would have improved because of maturation alone. And so these therapies are taking credit for maturation, or they're taking credit for a parent spending a little more one-on-one time with their child. Because if you're using this like workbook, and that's where like pros and cons and, risk to benefit comes into play, right? Like, oh, I'm using this workbook, but it's really just that I spend a dedicated 15 to 30 minutes with my child every day doing an activity. And that alone, regardless of the activity, could have also helped. Like there's nothing to say that that was going to influence that. And the other thing that I would say is, I'm like getting ahead of myself. I need to just like,
no, you're good. You're good.
Bring this back together.
Go, girl.
Basically, it's really easy for pseudoscientists, people sharing misinformation, to pathologize, meaning create a problem out of something normal to sell you a solution. Like that is what it comes down to. Like sometimes we have to just take a step back and reflect and go like, wait, is this actually a problem? Is it actually affecting my child functionally, their quality of life in their day-to-day? Or did somebody try to convince me it's a problem, but it isn't actually? And and it does not say that, like, I'm not trying to invalidate concerns from parents, but we just have to be really careful then who we are seeking support and information from to make sure that it is aligned with the research and the evidence and not just somebody trying to sell you a solution for a made up problem.
Yes. And I feel like this is a really good segue into really understanding the risk versus benefit. And because it's like, okay, some parents might be like this, you see this thing, it speaks to you, you feel like that's your child and you're like, I'm going to do this. Okay. So now you're just spending time with them, right? You're spending a little more time. You're doing some simple things. Like what's the harm in that? Right. Like, but what that takes away from is oftentimes finding the root or finding the real issue. Right. So
yeah.
I love when you talk about risk versus benefit and understanding why, even if it's a harmless, because I think that's also a huge claim, when these pseudoscientists are confronted with the challenge that it's not backed by evidence. And we know that it's not all about the evidence, right? Like we know the pillars that are important. It matters what a family wants. It matters what we anecdotally know as clinicians. It matters what the evidence says. But oftentimes I feel what I see is that when a lot of these people are confronted with being asked questions about it, they revert to, it's not harmful. It's not going to hurt them. And so I would love to hear
that one really gets me. So I think here's the thing, if it not being harmless, best case scenario, absolute best case scenario, there was not actually anything going on with that child. The parent was over concerned about something. And so they did these little things. Maturation happened. Everybody's happy because child is developing well and changes are happening. Best case scenario, okay? Worst case scenario. Well, I don't even want to go to worst case, but let's just say it's not best case. Every other case is preventing the child from getting the actual services that are going to help. It's delaying treatment, which can then have the ripple effect of, because you delayed the most appropriate treatment, now we are having difficulty with attention and behavior and meeting our motor milestones. And now we are having difficulty with XYZ. And we've wasted 6, 9, 12 plus months doing a treatment that said it was going to help, but instead we're actually further behind. And so we have wasted time, we have wasted energy, we have wasted resources. We now have potentially a misdiagnosis. We have potentially missed out on treatments that are evidence-based that could have provided all of that support at the same time. And I think too, some of these providers that are offering some of these things, I would, if there are any providers listening, I would just really say like, hey, I'm not saying, and this goes into the family values thing, if I have a parent who's like, I really think this thing is going to help, for whatever reason, and we've talked about the limitations, they're fully aware, they can make that informed decision to say, I know there's limitations, but I feel like it's going to help, then by all means do that. But don't do it in place of an evidence-based approach. And I think that's the part that I kind of like hit on, and I talk to people all the time, like, I am all for complementary support.
Totally.
Like I like if you are having difficulty, with anxiety, and you see a psychologist, you do your talk therapy, you take your medication, and you know what? You pull out an essential oil because a little sniff makes you feel better, do it. But don't do the essential oil and not seek out talk therapy medications as needed. Don't forget those. And I think that's where we have to be careful with some of these things, because we think risk to benefit doesn't matter. But it does. It does matter if it is keeping somebody away from an appropriate diagnosis and an appropriate treatment. This is an extreme example, but like, I'm going to bring it up because like, I think it's really important to note. So there was a study, and this was done for cancer treatment. Okay. It was by Johnson and colleagues in 2018. And it said that people who use alternative medicines alone for cancer treatment have shown more than double mortality rates in a 5-year period. And it literally could have been completely alleviated had they used evidence-based methods. Double the mortality rate in a 5-year period. And interestingly, the people that sought the alternative medicine routes were more likely younger, female, more educated, and a higher income. And I say that because we think I have a master's degree. I have this. I'm well trained in this. And yet, those tend to be the people who go for their alternative treatments because they can afford it. They have the time. They feel like they know more. Mm-hmm. And then that's who falls for it. And I think that that's just such an important thing to remind ourselves, because nobody is really safe from it. And so when we think about this, like, oh, it's low risk or it's not likely to cause harm, just like in that study, right? Oh, if I just eat healthier, that's good for me. But if it's keeping you from evidence-based methods, it can be harm, because wasted time, wasted money, wasted resources, wasted efforts, misdiagnosis, preventing you from seeking out medical evidence-based treatments is harmful. So best case scenario, the child didn't have a problem to begin with and they continue to mature, but we have a lot of other scenarios where things do go wrong.
Totally. And that really, I feel like that leads really nicely into understanding the importance of task-specific treatments and protocols and evidence and what we know to be true about the neural process and motor learning and all of those things. So let's talk a little bit about that. Oftentimes, maybe let's start with the example of like that it's a retained primitive reflex is impacting handwriting, or the ability to tip your head back and get your hair washed. Let's talk about that.
Okay. Yeah. So what we know about motor learning and what we know about how we develop skills is that it needs to be as task specific as possible. Now, there's multiple principles that go into motor learning and motor learning and neuroplasticity, but I'm going to kind of like put it all together in one example, because if I just list through all of them, it's going to be too much for now. But if you want to learn more about it, just search principles of motor learning or task-specific neuroplasticity. But basically, in a nutshell, what this tells us is that if we want to learn how to do something and we want to improve at something, at some type of skill, we have to practice the actual skill. So if, for example, what was the first one that you said?
Like handwriting or tipping your head back.
Handwriting, for example. The best way to improve handwriting is to get more practice with handwriting. And when you add in things like, let's, change it up. Let's use different types of writing utensils. Let's write upright on a board versus down on the ground versus like different positions. Can we write while we're standing? Can we write while we're sitting? Can we write with a rest for our elbow and not with our elbow? And so we can add in all of these different layers to something that's still working on improving the skill of handwriting. And so you might scaffold. And so you might say, okay, I need to add more supports. And then you might take away those supports. And so that's one example of those. Head tilting back. Let's say that you were saying to like get your hair washed and you need to go backwards with it. If we never practice a head tilt backwards, it's going to feel foreign. It's going to feel uncomfortable. It's going to be something that we reflex through a little bit until we learn, okay, here's how I can do this movement in a controlled way and lean my head backward into, a sink to get washed, or,
Yeah.
even just leaning backward on a chair a little bit and holding that position, or you're in the tub and the child's sitting and leans their head back without it becoming something that they're, having a reflex associated with it. And, it's across the board. I think something that comes up with motor learning is people will say, well, if they don't have enough strength, right? They have to build strength to be able to do XYZ. And yes, motor strength and the coordination, it all comes together. Strength is not the only thing. And the example I love to give, because I feel like parents can relate to this really well on why task specificity is so important, is that let's say that somebody is in the gym and they lift weights, a lot. Can you tell? If you can't see the video of me right now, it's just me pretending to lift weights, which I obviously don't do very often. But they lift weights and they are like the strongest. They can lift the heaviest weights of anybody ever. And we're like, perfect. Because you're so strong, you should be able to throw a football really, really far. Go throw a football in a game. No. They've never practiced throwing the football. They might be strong, and that's part of it, but that's not the whole thing. They need to be able to practice throwing a football, and then throwing a football to a target, and then throwing a football to a moving target, and then throwing a football to a moving target while somebody's waving their hand in their face, while somebody's trying to tackle them. And so the task specificity, the best quarterbacks are the ones that practice actually throwing a football under all those other circumstances to increase the difficulty and change it. Are they working on strength also? Yes, absolutely. But that's only one part of it. And so back to primitive reflexes, these primitive reflexes are integrated through those functional movements, through those movements that move toward motor planning, motor control, so that they can become more voluntary. But the primitive reflex are helpful to even get the infant into some of those positions, to even get them to the point to want to interact with their environment and get that feedback so that they don't stay retained.
Yeah. I think part of what you said earlier too about the hair washing specifically, for me, ties into, in part, the over-pathologizing, but also the immense sensory experiences that are specific to the bathtub, right? Because that would be the time where parents are like, I cannot wash their hair. Like, and then you see someone test it who's telling you, oh, it's definitely this. Could it be a piece of that? Maybe. But if you are having that experience with your child in the tub and it's a fight every single time, which it was with my kids, and they grew out of it, right? Normal part of development. But thinking also about the fact that like they are in the tub, they don't know if water is going to go in their eyes. Maybe soap has gotten in their eyes in the past and you didn't realize, and now they're scared it's going to happen again. All of these different things could also, and probably are also, part of the positive test during assessment that is very subjective. And if a parent is, again, already believing like, yeah, that's totally it, it's so easy to buy fully into that. And is it again, back to that, is it harmful to work on them being able to tip their head back? Absolutely not. But that's not it. That's not.
Well, and I think too, like, there's harm even to adding more burdens onto a family that has a lot going on. Like,
Totally.
Every parent ever, you have so much going on, and you go to this person. I mean, I would love to go somewhere and then be like, hey, if I'm being honest, and now does this feel good because you're seeking out a solution to something you think is a problem? No, not necessarily. But for someone to be like, hey, have you tried to just like have them do pretend hair cleaning while you're doing play and just tilt their head back, and let's just practice that. And let's practice that where I tilt them back and maybe I spray a squirt gun on their head just so they practice the position. And then we practice it, you know what I mean? I'm like, just go try some of that and like in a few weeks, see if it changes. And guess what? It probably will. Instead of the burden of, I have to go see this provider once, twice, 3 times a week. I need to do these quote unquote exercises, follow this regimen every single day. Parents don't have time for that. Like, right. You want the most like bang for your buck and your time and everything. Like, so often is it actually these things that are just like you said, like, we just have to keep doing it. Like, we just got to get them used to it. And you'll have a kid too that like one time you missed and you got that water on their face or that soap in their eye. And so now every time they lean back, if you could see me visually, it's like their eyes are blinking, their mouth's open, closed. They're like not sure what to do. They're scrunching their shoulders and leaning to the side instead of just back when you know that would make it easier. just because
Totally.
they're afraid to go back to it. And so
Yeah.
we have to think about like all these other factors that could be playing into like what we're seeing. And it feels good for someone to say, "Oh, there's this one thing and you fix this one thing and all of that stuff's going to get better." That's just not realistic. And I love that. I'm glad you brought that one back up too, because it is like, when do you lean your head back other than bathing? Like,
Totally.
never.
Totally. 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 And that I see that one all the time on social media. And I'm like, that's,
Yeah.
and okay. So going into even more, like we talked a little bit about specifically the claims that I feel I see the most of, and I have a feeling you'll agree about just extremely broad claims being made about retained primitive reflexes, right? Many of which are lacking plausibility. They're leaning pretty heavy into fear mongering tactics, emotion, almost dangerous at times, especially related to specifically ADHD, anxiety, and I see autism a ton. And I think that
Mhm.
what I would love for you to touch on is really, again, that like it is possible for a reflex to be to be retained, but integrating it does not necessarily mean you're going to see improved outcomes on the actual diagnosis, right? So uh, I would love to hear you talk a little bit more about that.
Well, I think it's too, like, sometimes in this situation, it becomes a little bit of semantics. Like, sometimes I'll find that a provider who's saying, like, oh, they have this retained primitive reflex. You need to try these functional activities to try to help them learn to walk, for example. So, like, maybe they're trying to say, the whatever reflex is preventing them from being able to walk. And so, in order to integrate this reflex, you need to do these exercises, which a lot of times are just like these random based exercises. But then they're also working on function based exercises. They're also working on them walking. They're working on the movement. They're using the principles of motor learning. And what happens is the child shows progress not because of those random exercises and because of trying to integrate the reflex, but because they're doing the function based movement. And so that's where like we have to, for parents that are listening, is try to kind of like weed that out, because you probably could spend less time and effort just doing those functional movements than doing this whole whatever curriculum rather than just practicing the task at hand.
Actually, I want to pivot to the nightlight study. I feel like this is perfect because that when you shared that study with me about the nightlights and the nearsightedness, and
Oh,
that
yeah.
for me, that was such a good clear way to break it down for parents to understand like this is a lot. Like we're throwing a lot at you, right? Like you are getting information that you maybe you truly believe, and that's okay. Like but we're trying to like
Yes.
give you all of the information so that you can make an informed decision with that is best for your family, knowing all of it, knowing the
Yeah.
ins and outs, knowing all of this stuff. So
Yeah.
this
Okay. 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 Let me pull back to that. Okay. So, for example, when we're looking at like these claims, so first of all, these broad claims, if we see broad claims like retained primitive reflexes cause ADHD, anxiety, autism, ADD, whatever, that it and it lacks plausibility again, right? So we're saying retained primitive reflex typically point to something neurological going on. Could we see autism and retained primitive reflexes? Absolutely. But one did not cause the other one. We just might see them correlated. And there's really no science to say that. There's no science saying that retained primitive reflexes cause anxiety, cause autism, cause ADHD. And so they're more of a symptom. And again, going back to like, if there is that symptom actually present, we need to be thinking neurologically, we should probably go see a neurologist. And so sometimes we'll see like there is an improvement in one or the other. But also recognizing that like a child could have all the reflexes integrated and still have difficulty in some of those areas if it's not targeted in the functional manners. Going to the nightlight studies, there was a study in 1999 that showed that infants who sleep with nightlights are more likely to develop nearsightedness. And this was like, oh my gosh, nobody should be using a nightlight. Like your child's going to have difficulty with seeing. However, what the study failed to address is that infants who had nightlights in their room had parents with nearsightedness. That's why they used the nightlight, because they couldn't see. So sure, is there a correlation? But yeah, but genetics is what played the role. And that is what needed to be highlighted in that study, not the nightlight. The nightlight did not cause nearsightedness. They're more likely to have nearsightedness because their parents had nearsightedness. And so this is why in the studies that we look at, it's so important to control for those other factors, especially and consider, like, based on past research, what's the plausibility of something like this occurring? Because sometimes you'll see, like, for example, like, even though that study has been disproven repeatedly, you'll still
And
see.
I think that's the key. I think that's the key, that
Yes.
it has been disproven.
It has, but you'll still see fear mongering around that claim. You'll still see people claiming, oh my gosh, don't use a nightlight because it's going to cause. Similar was the issue when this was like, I don't know, like a year ago or something, where people were saying that like sound machines cause auditory processing issues. It's like,
Sent me into a tailspin real quick at
yeah,
first.
right?
Until,
Every
yes.
parent ever. And it's like, no. Maybe there's some correlation in there, but okay, don't be blaring it right next to their head, just like with any other noises. Like, we are fully aware of that having been an issue and the plausibility of some little background noise causing an issue. Like, if that's the case, then like every child who lives in New York City should have hearing loss and auditory processing because their baseline noise level is going to be louder than, right? But anyway, but it scares people, right? So it scares people, and then that's what hits. And then we see all these studies that debunk it and say, hey, that's actually not true. Here's what's actually correlated. But that doesn't tend to get spread as quickly. And so, retained reflexes can suggest a correlation, which should warrant further investigation, further assessment, but that should be looking into the neurological diagnoses or deficits that may be going on.
So what would be your top tips for parents? What can they do to actually help reflexes integrate if they think that that is what is the cause of what they're seeing right there, and or to determine what a legitimate treatment option should or might look like? And you touched on this a little bit before, talking about how we're pulling in that motor learning piece with the functional movement, and we're practicing all of those things maybe in conjunction with other exercises. That what would you say parents need to know to be able to say, oh, this seems legitimate? And we'll talk in 1 second about misinformation and actual like research, but just in terms of what a legitimate treatment should or could look like, to wrap that piece up for them.
Yeah, absolutely. So I think in a nutshell, we want to be looking for functional movements. When I say a functional movement, I mean something that is specific to the task that you're seeing your child having difficulty with. So if you're reporting that your child is having difficulty with maintaining attention, the activities should target supporting their attention, should move in the direction of that. If your child is having difficulty with handwriting or writing, the intervention should be task specific. It should be working on writing. If we are seeing things like, I'll give just an example that I see in the feeding world a lot. So from a pediatric feeding realm, a lot of times it'll be like, oh, this child is having difficulty with, let's say chewing. And they're like, oh, they're having trouble with chewing because their rooting reflex hasn't been integrated, or, whatever. And so they might do exercises like give their child different like chewy objects and like, okay, let's do 10 bites on this side, 10 bites on that side. Let's warm their mouth up with vibration. That has nothing to do with chewing actual food. And so if we want a child to learn to chew actual food, we have to practice chewing food. And so that might look like we're using different modifications for it, but we're doing it as specific to the task as possible. I recognize that we can't just be like, oh, they're having trouble chewing, well, let's just give them steak to chew on, okay? No, that's not how it happens. But we want every activity and the interventions that providers are giving to you, you want it to be as close to the specific task as possible. And if it feels like, I'm not really sure how this is related, ask how it's related. Ask the provider to explain how this is supporting your child from a motor learning foundation, from a neuroplasticity standpoint, and they should be able to answer it. They should be able to give you that response. The second thing that I would say is if you are like, I don't know about this treatment, or I'm not really sure about this approach, or you're not really sure about the information, never be afraid to ask for references or studies or a second opinion about what's going on. And also, a quick Google search can seriously let you know a lot of information about if a practice is considered questionable or not. So if you literally put in retained primitive reflexes pseudoscience and you put in motor learning principles, pseudoscience. Retain primitive reflexes is going to give you a whole bunch of stuff that says, hey, be cautious, red flag. Yes, they are true, but not this treatment, not these things. And it's going to give you a lot of that. If you put in motor learning principles and add the word pseudoscience afterward, it's going to be like, no, actually, this is an evidence-based approach. Like, hold on. So sometimes just the way you're searching, like Google and search engines and our algorithms, they like to feed into confirmation bias. They like to feed
Totally.
you what they think you want to hear. So sometimes just by altering, by saying like, okay, give me the other side of this. And I'll do that even when I'm searching some of this stuff. I'll be like, okay, I want to search it from the point of someone who's like totally bought in. And then I search it from the lens of someone that's more skeptical. And you can find all of those different pieces. And if you find one that's like, hold on, actually, there's just a lot of evidence on this, and this looks pretty good and like promising, that's probably a really good approach to consider. And so you want to, that's just like a quick tip of something you can do. If you're like, hold on, stop, let me question it, especially on social media, you see something, you're like, wait a minute, just do the quick search and like, you'll see pretty quickly.